Katie McHugh at the World's ADC Summit with Troy Lester, who is a senior scientist at Human Genome Sciences. And we're here to talk about your BLyS targeting antibodies and their potential for conjugation and potential applications of that.
Well, actually, the drug is not an antibody. We're actually using BLyS as a ligand drug target as a focus as a poster. So it's a little bit different than the focus of the meeting here, which is antibody drug conjugates. Our company's also interested in those. But in addition to that, we've got these ligand drug conjugates, which we're interested in. And the molecule I've made is not actually a drug conjugate, it's a fusion protein, a fusion toxin. A combination of BLyS, which is a survival factor required for the growth of B cells, normal B cells and malignant B cells. And we take that factor that normally allows the survival of these B cells, conjugate it to a plant toxin, and now this factor that, like I said, normally allows these cells to survive, it now becomes a toxic molecule that actually kills them. So we've done some preclinical studies and some mouse xenograft models to show that in certain subtypes of B cell non-Hodgkin lymphomas, like mantle cell lymphoma or diffuse large B cell lymphoma, that this fusion toxin has a nice ability to prolong the survival of these animals.
So, prolong the survival by how long? What's the?
So, in one of our models, based on there's different treatment regimens, but when we start treating the animals immediately after we give the disease and treat them twice a week for up to 6 weeks, we get a 70-day extension of survival, which is fairly significant in animal models. So if you see a 2-week increase in survival in a mouse, that's usually rather exciting. So to see 70 days is rather robust.
Okay, what's the plant toxin you're able to use?
The plant toxin is one that's been around for a while. It's called gelanin, so it's a ribosome inhibitory protein. So it gets into the cells. Similar to these antibody drug conjugates, it's thought that it's then separated from the ligand BLyS. It gets into the cytoplasm and it actually causes an inhibition of protein synthesis, which then leads to the death of the cell.
Okay. And so obviously your company had huge success a few months ago with the approval of Benlysta, first lupus treatments in
50 years.
50 years.
Right.
So is this belimumab what you're playing around with?
No, it's actually not. I mean, we have, based on the work with belimumab, we're very familiar with BLyS. So belimumab is different. It actually binds to BLyS and prevents that survival factor from interacting with the cells. So in that case, lupus, you have an overactive immune system that's primarily driven by this B cell specific phenomenon, which is driven by overexpression of BLyS. So in that case, you're using belimumab is removing the BLyS from those B cells. Therefore, it doesn't directly kill them. It's more of an indirect killing by loss of this important survival factor. The molecule we've been talking about here in the poster that I presented here today is actually the molecule itself. It's not an anti-BLyS, it's actually BLyS molecule itself that we've just turned into a toxic molecule by fusing it to this plant toxin.
Okay, and what are the next steps for that? Are you undergoing further trials with the BLyS molecule that you were talking about in the poster?
So, right, that particular molecule, we don't really envision gelanin as being the final format of the drug. Plant toxins and bacterial toxins have been moving forward in the clinic for a number of years now, but and there's been a lot of work done to try and de-immunize those, but there continues to be these issues with getting an immune response to these foreign proteins which you take and put into a patient. So these plant toxins have that difficulty around them. So I'd actually like to try and generate a BLyS drug conjugate. So instead of fusing it to this plant toxin, take some of these molecules we're hearing about here at the meeting, such as the auristatins and the maytansines, and conjugating the actual BLyS molecule itself to those drugs, which would then be much less likely to be immunogenic, be more likely to be effective in the clinic.
So it's back to the lab then?
Back to the lab, right. Take what we learn here, maybe generate some networking opportunities to interact with some of these other companies that have access to these highly potent cytotoxic drugs and do something a little bit different than the antibody conjugate, do a ligand conjugate.
Okay. And then so with regards to payloads, have you seen any new and interesting approaches today or heard of any recently of new payload technologies that have caught your eye?
Well, I've heard about several today. We just came out of a talk from a gentleman from Roche who was talking about this bispecific approach to using a digoxygenin molecule that's used to different toxins. So that's one I hadn't been familiar with before. It looks like there's some promise there. There's the auristatins and the maytansines, which are been out there for a while now. Those continue to be exciting, all the different developments. They're coming up with the different linker technologies to make those more effective. So I've learned a lot. I'm glad I had the opportunity to come.
Great. And is there anything else you'd like to talk about whilst we're here?
Not really, not in particular. Just enjoying my experience here. Looking forward to tomorrow. I think we're going to have a lot more. So I guess I would talk about, we have other molecules that we're interested in HGS. So we have other targets that we're interested in. Can't really elaborate on those, but that's another reason for being here, that in addition to these ligand drug conjugates that we've been talking about, we do have interest in antibody drug conjugates as well. So back from our days when we were sequencing the human genome, we patented a variety of genes that we'd sequenced. BLyS was one of those. But we've got others as well that we're interested in. So we're here to try and learn about how these other companies who've already been through the process go about doing their target selection, their antibody selection, their linker selection, their cytotoxic drug selection, all those different processes, and learn from them so as we move forward in our antibody drug conjugate endeavors, that we can do that more efficiently.
Okay. Can we talk a little bit more about BLyS? Like, what are the other potential applications for targeting that? Like, obviously you've got lupus and you're talking about non-Hodgkin lymphoma. Is there the potential, is it like an anti-CD20? Could you go and look at things like MS as well and RA?
So it's not quite like an anti-CD20 because CD20 is a cell surface protein, the receptor that's expressed on the B cells, whereas when you target BLyS is a soluble ligand which is in circulation. So the antibody doesn't actually bind to the cell, it binds to this ligand that is required by the cell for survival. But there is some literature out there to suggest that not only does BLyS allow for the survival of these autoimmune cells that are the driving force behind the symptoms that people with lupus have, but there is evidence out there that people with lymphomas also have elevated levels of BLyS, and that it's possible that if you treated with an anti-BLyS like belimumab, that you might be able to treat the disease that way, the same way that we're using it for lupus, to deplete that important survival factor from those malignant B cells. So that's something, as the belimumab goes through the life cycle progression at HGS, that's something I think they're definitely looking into. I think Seattle Genetics or another company generated a receptor trap. So there's two receptors that bind BLyS. One's called BR3 and one's called TACI. So I think at Seattle Genetics it's generated a TACI FC. So basically they're taking the receptor for BLyS, fusing it to an FC portion of an antibody, and generate a molecule that's referred to commonly as a trap. So it basically, it's not an antibody, but it binds to the soluble BLyS and prevents it from interacting with receptors on the cell surface. And I think they've taken that into phase 1 or phase 2 trials, and I think it's not toxic as far as I'm aware. So it's got a good safety profile. I don't know if they've seen much response yet, but there is some thought around using, or the potential to use belimumab as one of these reagents that can deplete a malignant B cell of this important survival factor, BLyS.